Hey, everybody. I'm going to give a few minutes before we get really into the webinar, just as it takes a few minutes sometimes to get going and into, logged in and all that stuff when you're at home and it's nighttime and you've just finished working and all that stuff. Some of you might have seen my baby on here. So all my kids are staying up a little bit later and watching a show. But into the chat, if you guys don't mind, I'd love to see where you're coming from, where you're practicing, what state, all that type of stuff. I'd also like to see if there's anything postpartum treatment wise that you are curious about, because there's a section of this webinar that I can dive a little bit into that. So if you could say like where you're from, Missouri, I might be out there in September. That's exciting. At I think there's an ACA women's health pediatric conference that's going to be coming up that I will be speaking on about postpartum rehab. So I think at Logan. I don't know how far you are from that, Erin. So let's have you write where you're from, like I said, and if there's anything postpartum that you are really wanting to know about treatment wise, that's not going to be the main thing about this webinar, but it's going to be something that I dabble in. And if there's something you're just dying to know and curious about, I would love to answer that for you. Nice. We've got Wisconsin, Vancouver, Illinois. Awesome. It's nice to see people from all over, all over. And if there's anything that you are curious about, go ahead and type that in. Anything specific you want to ask about with postpartum, I will try to answer some of those questions. And I do want to encourage you as we go along to please type in and answer those. Now, I'm going to try to make sure that, because this is going to be recorded, that my screen shows up as like the big one when it's recorded. Because right now it's not. Real quick, just before I get diving in, can you just type a yes if this is the case? Is me speaking, is that coming up as the full screen for you guys? Okay, sorry. Thanks for working with us, you guys. I'm trying to make sure that I'm recording it the right way. So my husband was coming in with the baby and the whole crew. Oh, there's a Castle Rock, Colorado. Yeah, not too far. Be passing by your way not too long because we're going to do a Colorado trip down to Durango for a wedding. Some people I went to school with. Hey. All right, so I'm going to get started since it's a few minutes and I don't want to waste any of your valuable time at night. So how to become a postpartum expert without spending thousands of dollars in countless weekends and seminars. Because if you're like me, you don't want to spend all your money on courses, especially ones that may not give you CEs. Ours, though, do give you CEs if you are in a PACE approved area. So I'll talk more about that at the end. And then also the weekends. Like, I love learning, but when I have to give up a weekend with my family or an adventure like camping, I'm like, no, I don't want to do it. So how can you become the expert without spending thousands of dollars and without using all of your weekends to do this? So this webinar is for chiropractors who are passionate about women's health. And I'm guessing that if you're on here tonight, like that's you. Those who want to expand their knowledge and their skill set to get better outcomes with their postpartum patients. Because if you aren't aware of postpartum and all of the many things that encompass the postpartum patient, then you're going to be missing out on a lot of things. Can you adjust any human? Yeah. And you're going to be able to adjust a postpartum patient. But what things do you need to know and be aware of to help serve them the best that you possibly can and to keep them as a patient coming to you and referring their friends? This is also a webinar for chiropractors who already treat prenatal, but perhaps many of them don't return after giving birth. They don't bring in their newborn for care, and maybe they're not following your postpartum treatment plan and your recommendations. And it's also for the chiropractor who wants to become the postpartum expert in their community. So this webinar is not for the chiropractor who is just limited to their adjustments and don't really care to incorporate new information or the holistic approach. So what is the holistic approach? Well, holistic means full body, whole body. So you can argue chiropractic impacts the whole body. However, what else can we be adding in with nutrition and rehab and mental health and all of that type of stuff? All right, sorry, I'm trying to get into my screen here and I'm having a hard time getting into the screen on my computer. My husband's on standby to help me with his computer and everything here. So one moment here. Yeah, come in, please. I couldn't get it to this screen here. You guys are dealing with me not having used Zoom in a long time. All right, sorry about that. So holistic care is a huge part of my courses and my way of teaching other chiropractors and my practice itself. So let's talk about who I am. So I'm Dr. Nichelle Gurley. I am a mom of four. I practice with my husband, Dr. Antonio, which those of you who are in school with me on here, you know him. So we have four kids. I'm a chiropractor. I have been for a decade now, actually over a decade, which I'm like, how has time gone by that fast? I'm also a personal trainer. I am a birth doula, though I don't practice that anymore because life is too busy. I homeschool my kiddos. I live in Colorado outside of Boulder. For those of you who know Colorado, we live a little outside of that, and we have a little tiny farm. It's big for our area, but it's a little tiny farm that we are living that homesteading life on, and it feels really, really good. My husband and I both practice together about 20 minutes from our house in a town called Lafayette, Colorado. It's also outside of Boulder. And I work part-time right now because four kids is a lot. I've been focused on postpartum care though for over a decade. More of that came about once I became postpartum myself with my first child, because I realized, hey, I'm a chiropractor, I'm a personal trainer, and now I'm sitting here and I have no idea what I should be doing for myself. And providers didn't really help. I had wonderful midwives, but they didn't give me much care. They weren't really focused on what exercises I could do and when I could return to it, and suggesting chiropractic or anything really for that matter, or nutrition. None of that was given to me. And as I began learning more, I was like, what is this about? We need to be giving women more of this information. This is actually quite unacceptable that we're not. So, I've spent four postpartums thinking each time about my patients, myself being postpartum. I have had a decade clinically treating, but beyond that, I've learned so much from the experts, not only in my community, because Boulder County area is a birth mecca. We have so many providers, wonderful OBs, midwives, OTs, lactation consultants, pelvic floor PTs that are some of the top in the world. There's a lot that I've worked with who have gone on to create really prosperous programs online, birth courses, prenatal fitness platforms. And it really does have so much in this area. So sometimes I take that for granted. But I've learned from all these different professionals, very few actually chiropractic, to really learn what else is there with this human body when we're postpartum that we need to be aware of. I've learned from those PTs around me. I've learned from the lactation consultants from England to Australia and beyond. And this information was so important to me. That's actually what really grew my prenatal practice. Is actually I became so much more focused on postpartum. And then it was like, well, I might as well treat prenatal, I guess. That's important too. So I want to encourage you guys as we go along. If you have any questions, I would love for you to ask them in the chat, and I'll go through afterwards and peek through. I see right now, one says, I want to know your top two go-to recommendations for patients. I'm assuming you mean postpartum patients, but if you don't, let me know. And then also curious about diastasis treatment and what exercises to do. And woof, that's a tough question, mostly because that could be a 10-hour course in of itself. But we'll see if I have some time to address some of that. So what are some problems you might be facing as a chiropractor? Specifically one who is treating postpartum. Maybe it's more of a prenatal practice that you have, but what is it that could be going on that is not ideal for you? It's quite the problem. And then perhaps it's that your patients that are prenatal don't return after giving birth, and then they don't bring in their babies for care. And you're like, they loved me during pregnancy. Why did they not come in postpartum? What did I do wrong? Like what's that missing link there? You might also not feel confident in your assessment. So you might just be treating them just like anybody else. You may not know what to ask. You may not be confident in your treatment skills specifically for postpartum patients. And you're going to want to improve your treatment outcome for your postpartum patients, right? So if you're not feeling confident with your assessment and treatment, you're not going to have the greatest outcomes likely. And why are you not confident? Well, probably because this is not taught in most schools. I know for sure it was not taught in mine. There was an OBGYN class and there was a pediatric class. And if I could be honest with you, I learned virtually nothing from both of them. Yes, there were things in it, but it wasn't the real information of what you really truly need to know about treating these populations. And a lot of that is because professors are just not in private practice. Or if they are, they're so distracted by their private practice that when they come in to teach, They're not really focused on like, what do the students really need to know? You go into clinic, and our clinic didn't have a ton of pregnant patients, didn't have a ton of pediatrics. And heck, I don't even know if there was postpartum women there because I didn't treat them. And it would have been really awesome to have had more of that information in school. But the reality is that we didn't. So a lot of us probably didn't feel confident right out of school, really treating this population. And if you didn't continue to learn more or go through yourself, you probably are a little bit more lost than others as to what to do. Now, another problem is that your postpartum patients may not be following through with your recommendations. And we'll talk more about this, but why might they not be following your recommendations postpartum? What could be going on there? So, what are the possibilities though? So, we have the problems, the things that might be going on for you that you're facing. I think the biggest one that I had faced back in the day was, yeah, there was maybe not the lack of confidence in my assessments, but I kind of like didn't know what I didn't know. But it really was that I got the prenatal patients in because people knew they needed to come in. I had the referrals from the OBGYNs coming in, the doulas saying, like, you got to see them for a great birth. Awesome. Great. Got them in the door. But I wasn't the best initially at making sure that patients came in postpartum. And now I can say confidently, almost every single one of our patients comes in postpartum unless there's some really extraneous circumstance, such as they live in the mountains and we're down here for prenatal care and they're 2.5 hours away. And it's like, well, yeah, they're not going to come in right away. But what could you do? Here's the thing. You don't need prior experience, and you don't need to spend thousands of dollars in weekends and seminar to really feel confident in treating postpartum patients. You can start improving your patient outcomes. You can increase the number of prenatal patients who return after giving birth and also bring up newborn if you do the right things. And you can be that expert in your community, the holistic chiropractic postpartum expert. That can be you. You want to be the leader in your community, and you absolutely can do that. And you want it to be that people don't just think of you as prenatal, they're thinking of you also for postpartum as well. So here's the biggest one. And this is the one that I actually really want you all to focus on right away in practice. The biggest thing you can do for yourself to get the prenatal patients in the door, postpartum patients in the door, is to start the conversation prenatally. So starting the conversation about what postpartum care looks like, about what pediatric care looks like if you also treat pediatrics, needs to happen from the first time you see them prenatally, and then sprinkling it in throughout all of their prenatal sessions. And I'm imagining most of you, if you're treating prenatal at this point, you are seeing your patients probably 6 or more times during their pregnancy, unless there's somebody who comes into you at like 39 weeks, 38 weeks because they're a breech baby. But if not, you're seeing them throughout their pregnancy. You are probably seeing them a lot more than 6 times. And so you have so many opportunities to plant the seed and allow it to grow and to ask questions, ask what questions they have about postpartum and pediatrics. So I want to start with, what do I do in regards to that? So beginning in the prenatal initial session, I start there. Of course, I address what they came in for, the pains they might be having. I also want to know what type of birth they want. I want to know kind of how to help them with their birth team. But then I go into talking to them about the shifts that the postpartum body or the pregnant body has. All of the center of gravity changes, all the ligamentous changes, all of the things. I show them pictures. I bring out a pelvis, and I break down what I'm going to be doing in my prenatal session. And while I'm there, I start diving into, now look at all these changes that happen in the pregnant body. And then birth, there's something called the rhombus of Michaelis, and I show them a picture of that. And if you haven't seen a picture of that, look that up. Rhombus of Michaelis. You will see the bulging of the sacrum if you're seeing a woman not on her back. So if she's on her side or on all fours, you will see, or kneeling, you'll see her sacrum rocking back and out of the way as that baby's coming down and in. And I show women that picture very much so to let them know why a postpartum appointment is absolutely necessary for them, not just a suggestion, because you see how much that sacrum comes back and pulls out of the way. And I let them know that when it goes back, it doesn't necessarily settle in perfectly, because even if you're delivering on all fours, you then go into this laid back, baby's on you position, and your sacrum is so loosey-goosey that I find a majority of my postpartum patients do not have the best positioning of their sacrum, whether I see them at a week, 2 weeks, a month out, or I didn't even see them prenatally, I see them postpartum at 9 months out. You feel a difference in that sacrum. So I show them, hey, one of the reasons the sacrum is like this is that rhombus of Michaelis, baby going through the birth canal and that sacrum coming back. And this can happen even for moms who end up with belly births, cesareans, because if baby starts engaging the pelvis, that sacrum can still be moving out of the way, and then they can be pulled off for a cesarean. Now, the posture breastfeeding is also another one that I talk to them about. So we start talking about the pregnant body positions and postures, and then I talk about, and remember, then postpartum, your sacrum might be doing this from birth, and you might be rounding, or not might, you will be around your baby, whether you're bottle feeding or breastfeeding, you're going to be rounding around your baby, different positions with sleep. You absolutely want to consider postpartum chiropractic care because of all of these shifts and changes on your body. And then if you are also a chiropractor who feels confident in your rehab skills for the pelvic floor or diastasis recti, then you can insert in information about that. And they can say, oh, you're aware of that and you know what to do. And you're like, yeah, you can come to me. You can kill two birds with one stone, and we can do your chiropractic adjustments and body work, whatever that looks like in your office. And we can start on any rehab to help you starting to feel better in your postpartum body after having your baby. So it's those initial sessions. So I demonstrate, I show what we're doing during pregnancy. I grab the pelvis out. I go through what all the changes are, not all, but a lot of them are, how those happen through birth, what happens postpartum, and how your sacrum has a hard time getting back to an ideal position because of all the postures postpartum. And then we dive in towards the end of that initial session. So that's usually in the middle when I'm talking about some things with the pregnant pelvis, and then I just sprinkle it in, right? But then at the end, I have very specific questions in my intake that talks about, what do you know about postpartum, especially if they're first time mom? How long do you think you'll rest postpartum? And a lot of them like, I don't know. What should I do? And then I insert in how long I expect them to rest and what rest looks like. What is rest? Rest is not necessarily literally resting, although I'd love that for moms, but it is laying low. It's not going to the grocery store. It's not walking around the neighborhood just because you can. I tell people just because you can doesn't mean that you should be, because we really want to allow our bodies to heal. And we talk about all that looks like. I ask them when they expect themselves to return to fitness, what they want to return to, and then ask them how they think they will do that. Because I do a lot of postpartum rehab and a lot of that information. So I ask them that in the initial session, so then they know that I do postpartum rehab. And we're going to talk about length of appointments here in a little bit. And also those of you who are like, I don't know if I can fit in rehab, that's not really designed into my treatments, what that can look like for your practices, because it's absolutely possible. I coach chiropractors who have way shorter sessions than me, 2 to 5 minutes, and they still are able to give their patients really good quality care postpartum by knowing this extra information. So in my intake, I actually go through what they're expecting for postpartum, and then I dabble in information about it so they know I am educated on it. I know how long they should rest. I know the exercises for them to do. Sometimes I pop up and give a demo. Hey, you're returning to run? I'm going to work on single stance movements because runners are in single stance when they're running. We're also going to be working on X, Y, and Z. And so I talk them through that. So they're like, oh, I should totally come to her to help me with some of this stuff. I also, at the end, just so I make sure I have time for everything else, I talk about what to be aware of with their baby. So we've already nailed in rhombus of michalis. I will tell you, if you show them a picture of that, that has really sealed the deal with every single one of my pregnant patients. They're like, oh yeah, I definitely should come in postpartum then, because they see a picture and an image of that sacrum back and they're like, whoa, yeah, I would want to come back in, wouldn't I? So that seals the deal. And the other stuff just dabbles in them being like, okay, she knows what she's doing. But for working with babies, it's really important to make sure that you let them know you do. So if they're in your office and they see the kid toys, they're not necessarily thinking baby. They're thinking, oh, kids come here. Not necessarily their kid or their infant, right? So I start saying, hey, and then just some things for you to be aware of with your baby is, if you're planning on breastfeeding, I want to make sure that you know that pain is not normal. And I am available. I want you to email me and let me know if you have any discomforts with nursing, if you have any supply issues, let me know. Like I check my email all the time. I want to send you a lactation consultant, and there could be stuff that we can help you with to make the breastfeeding process easier, whether there's tension in your baby, whether there's tethered oral tissues, tongue ties going on. There's so many things that we can work on to see what could be going on that we can improve for your breastfeeding journey. I talked to them about how birth is very normal and natural. However, It's a lot and it's traumatic on the baby. And you think about whether they come out vaginally or through cesarean, it's a lot on their little body. So having a checkup to see how their body is moving, checking their spine out is really helpful and vital. And I highly encourage it. We talk about what that looks like, and then people have their further questions. I tell them a couple things, like I mentioned. Breastfeeding should not be painful. Reach out with that. If your baby has a head tilt, whether they're just rotating, but if you see a rotation looking up and you consistently see that, if they hate being laid down on their back, if they seem extra fussy, if they're spitting up a lot, if there's other issues with breastfeeding, reach out. And so then they hear that and they're like, okay, that's something to be aware of. So we just bring these things to our attention, and that happens. I'm talking a lot right now to you, but all of this talking about the postpartum stuff, the pediatric stuff, this can be a 2-minute conversation or less, but it can be more if you have more time or if they keep asking questions as well. So then in my next session, that was all initial. In my next session, then I asked them, hey, I gave you a lot of information. Have you thought a little bit more about postpartum? Have you thought about having meals made for you or a meal train? What does that look like? Have you thought about what activities you want to return to and rehab care or anything about pediatrics? And then they might ask me questions there if they have them. And it's then that I talk even more in that second session about their rehab. Like, what does rehab look like for you? If you are returning to hikes, what does that look like versus somebody's returning to adult league volleyball, and how, the things that I'm going to want to do with them if they're wanting to return to volleyball, there's going to be a lot more impact stuff that's harder impact for them jumping up. And what does that look like for their core versus somebody who's going on runs versus somebody who's solely wanting to feel good in their body and return to walking. So it really is us chatting about what are their goals. And then I tell them what my goals are. So my goal is to help you navigate postpartum, get you feeling better in your body after being rounded so much, after the process of birth, help you navigate any aches and pains that you might be having because of being pregnant, because of your birth story, or because of anything postpartum, such as nursing and different positions that you're in. And then after that, I tell them, so that's my main goal. And then after that, I want to help you reach your goals with fitness. So if you really want to return to running, I want you to return to it as well. But I want you to return to it on a very specific timeline, and making sure we hit certain milestones and check marks functionally to make sure that you return to it in a wonderful way, right? Now, some of you might be listening and be like, I don't have time with my patients. Everything you just said, I don't have that time. I would love to, but it's not realistic for me. Hear me out. There's a lot of other ways that you can add this in, and other ways that we actually do as well. One of them is email campaigns, the campaign drips that you can do. So if you haven't done email drips, so you have a campaign, and then you have these drips that, goes out once they come to your office, then a week after, then the next week. You want to add that. It's so easy now through MailChimp and other email platforms. The reason why is because we have a prenatal email drip. So we have things in there about discussing, there'll be things in there about prenatal, but then there's things in there about postpartum care and when to come in. Things about infant care, what to consider. So they're getting these emails throughout their pregnancy. So if you don't have time for it, everything I just said and more can go into emails that you're sending your patients. And then when they come in, you could say, hey, did you get those emails? Did you see the email on X, Y, and Z? So I highly encourage you to do that. And also a postpartum campaign. So do an email drip postpartum. And we usually have that set to send out when they're 42 weeks or by 42 weeks, because we know that they'll have had their baby. And then obviously if we hear of something that we need to delay that, we can go in and delay that email drip from sending out. So that is something to be aware of, is those drips you can do. Prenatal one and a whole postpartum one. We have about 7 to 8 in each of our drips that just go out and ping them for different information. And patients will bring them up to me. So that's definitely really valuable tool right there to start the conversation. So we're talking about right now, just to go back, because I've talked a lot, is this 3-step solution to help you get to become the expert postpartum, to help you gain more confidence, is first off, starting with the conversation. Now, with that conversation, another option you can have, if you don't have it in your initial, maybe your sessions are 20 to 30 for your initial, is booking a review of findings prenatally. So a lot of you probably already do a review of findings. So if you can section out in your review of findings 2 to 3 minutes, if you have more, 5 minutes, awesome, to discuss postpartum and the importance of it, all the stuff that I just mentioned, that can be valuable as well. And just another tool of where you're bringing up that postpartum care, because you've already gotten them in prenatally. Now you want to get them in postpartum. Here's something else that significantly helped our practice with postpartum patients because we were getting a flood of prenatal. I had all the doulas referring, the midwives, the OBs in my area. And there was a time when I'm like, why are we not keeping these postpartum patients? What are we doing wrong? What we started doing was what I realized what I would need. What would I need? Well, if I don't book, and I'm curious how you all feel, but if I at my dental appointment for a cleaning did not book the follow up for the 6 months out, it might be a year when I'm like, oh man, I should probably get in for a cleaning. I totally forgot to book that one at 6 months. So we don't leave it up to the patient. I mean, obviously they have a choice to come in or not, but we don't leave it up to them to choose to book or not postpartum when they're postpartum. We give them that choice when they're pregnant. So I mentioned this in the first session or a few of the subsequent ones is saying, hey, and we'll book you out postpartum for your initial postpartum session while you're pregnant, because once you become postpartum, you're going to forget about it. You're going to be caught up in everything. And you as a mom are going to come last because anybody who's a mom realizes that's commonly what happens. You take care of everybody else and then yourself last, no matter how much Instagram and the internet tells us to put ourselves first. It just is what it is, right? So let them know that you're going to book postpartum. That's an expectation in your office. You really suggest it. And you've already mentioned to them why you want them to come in postpartum. So to them, no brainer, I come in. So we usually book out that session at around 36 weeks of their pregnancy. We book them for roughly the 42-week timeline, and we let them know, like, hey, if you go past your expected due date, which a lot of you will, and you want to shift it. So when I say that, I mean 41 weeks. So 40 weeks is their expected due date. I realize as I said that, but at 41 weeks, if you're still pregnant, we'll just bump it out. Don't worry about it. We'll just push the timeline on that. And then we also remind them that we give them calls and we check in on them saying like, hey, next week we have your postpartum session, but we have our front desk keeping track of when people are letting us know they've had their baby. So we just usually will text them, hey, let's bump your session out 2 weeks to this date. Does that work? They say yes. So there's a lot of more details around that. But if you're worried about the logistics of it, we usually book them at 36 weeks and we book them roughly at what would be their 41, 42-week timeline and let them know it's fluid. We could shift that as needed. If they have their baby at 38 weeks, we can see them sooner, right? So we'll fit them in. And then if they know we're going to make sure that we follow up with a call, they feel a lot more confident, like, okay, I'm not going to forget about this. All right. So the other part, the 3-step solution. So starting the conversation, sprinkling it in. We talked about all those steps of things you can do. Everything I said is stuff you can implement this week. Maybe the email drip might be a little bit hard because you have to come up with it, but you can absolutely start talking to them about what postpartum looks like. The other part is refining your history taking and your assessment skills for postpartum. That one's huge. So learning which questions to ask will lead you to helping your patient even more. There's so many times when I'm like, how did I not ask that question? I should have asked that first because that led me to X, Y, and Z. So sometimes I even miss out on one. I'm like, whoa, that one was really important. But if you have a quality intake, you should be able to catch a majority of those. As a side note here, if you are in Jane, you have Jane yourself, I do have a postpartum intake that my patients fill out ahead of time. So I know what I'm working with. And that is under the office. My office is Live Loud Chiropractic. And then it's titled Postpartum Intake Gaia Health. So postpartum intake dash Gaia Health is where you can find that Jane app. If you have Jane app, you can find my template for that to see what questions you could be asking. And I send that out to them ahead of time. So our office, before they have their postpartum initial, they get sent that so that I know what I'm dealing with. Are they going to want to check their diastasis? Are they having tailbone pain? What am I dealing with? It's nice to know because there is like quite the genre of things to deal with when it comes to postpartum. So you want to make sure that you refine your history taking skills and assessment and that you really know what to ask so you can learn about what symptoms they're facing because they may not tell you all of them because some of them are embarrassing. Not for me to talk about, but for them because they're not used to talking about, like down here, it's like all private, right? So we don't talk about like peeing our pants and pain with sex. We want to listen to what their lifestyle looks like. What is going on in their life? How are they sleeping? What is their job like? What's their relationship like? What is expected of them on a day to day? And then we want to know how to assess for those common postpartum conditions. So your questions really could lead you to getting them the right referral that they need or for you to really see what's going on. So here's just a kind of, I don't want to say basic example, but one that could easily be missed. So someone tells you that they have hip pain. And so you start diving into like, when do you feel it? How long have you been feeling it for? What positions do you feel it in? And they may not tell you that they feel it in a nursing position, which I'm actually going to scoot back for a second. So if they're nursing their baby like this, they are taking their hip and pinching it for a long time. And then they're staying there in that position nursing their baby. And this one happens a lot. So if they're telling you that they have hip pain and it feels really pinchy, you should be asking about what positions they're in for sleeping, because they might be sleeping with their leg up really high. They might be curled around their baby really tight and they might need to open up that position. They might be doing what I mentioned with that nursing position where they're just completely pinching that hip. So that's just an example of, okay, they have hip pain, but now you need to ask, show me what positions look like for you nursing. And you can even say, do you ever nurse like this? Or do you nurse like this? Or do you can like give them demonstrations of, are you doing this, right? So other questions that you can ask is, are you constipated? And if you just say, are you constipated? They might say no, because they don't know what constipation is. They think it's just you haven't pooped in a while. So letting them know, are you constipated? And constipation is you are not pooping every day, or your bowel movements are not sausage-like, soft serve ice cream. They are more like rabbit pellets. And they'll usually know what you mean, hard and lumpy. And they're like, oh yeah, and it's painful. And so then you drive into all the questions you can ask about bowel movements. And there's a lot you can ask when it comes to postpartum. So you want to ask, are you constipated and why? Because constipation can lead to issues with urinary incontinence. It can lead to issues with fecal incontinence. It can lead to issues with pelvic organ prolapse, which is a loss of organ support that can lead to a lot of heaviness sensations in the pelvic floor. It can lead to worse hemorrhoids or anal fissures. So really making sure you ask about constipation, but then not just asking about constipation, then telling them what constipation is, because most women are constipated postpartum. And then if they are, that should be one of your number one things that you send them home to manage, whether it's increasing their water, adding fiber. They might need to be adding certain herbs. They might need to have more time in their day to rest and sit on the toilet. They might need work on relaxing their pelvic floor. So there's so much you can insert in here, but you got to ask about it, right? You want to ask about, are you having any incontinence? And urinary incontinence, people are usually fine saying that they leak, to you at least. Now, if you ask about fecal incontinence, they may not like that. So how can you ask that differently? You might say, do you have any fecal smearing? Do you have any poop that might be in your underwear? Or when you go to wipe, do you find that after bowel movement you have to wipe a lot of times? That is an example of fecal incontinence that they don't know about, because they're like, I'm not pooping my pants. And they may not tell you about a little bit of smear in their underwear, or they may not be able to explain to you that yes, they keep wiping and wiping. They didn't realize that was actually an issue. So those are things that if you're aware of them and you don't bat an eye, like when I talked about it, did I make you feel awkward about it? Like, do you sometimes poop your pants? Like, no, I just talk about it. It is what it is. You are their provider. And then they're like, oh my gosh, like no one talks to me like this. They don't just talk about these problems that we have, right? Their OBGYN is not going through these specifics with them. It's just not happening. If they have a pelvic floor PT, they might, but many of the providers are not. And chances are they're going to be seeing you more. They're going to be seeing you as their chiropractor more than they are seeing their midwife or their OB. Is that sad? Well, not for us, but it's sad that that's happening, because they should be seeing their other providers more. So it gives us a really big role. We can have such an impact by the fact that we can see them more, because we're working on so many things with their body. We're getting their body to feel better on many, many levels. And we're approaching things holistically, or we can, which allows them to say, hey, like, yeah, I love my midwife, my OB, but my chiropractor really has a lot of great suggestions for me. And this is awesome. So let's talk about, we can talk more about breastfeeding, right? So I mentioned already, if we just say, how's breastfeeding going? They might just say, great, just the normal stuff. We want to dive in and be like, hey, just a reminder that just because something is common doesn't mean that it has to be, doesn't mean that it's normal. So with breastfeeding, I just want to know if you're having any supply issues. Are you having any pain? Is there any issues are you having a hard time getting baby to latch? Because then they're going to open up a lot more if you ask very specific questions. So what I'm getting at here is that you really want to know what to ask. And it's a lot different than, are you having any pain? Are you leaking? Constipation? Cool. None of those? Right, we're good. And you really want to ask those questions because they can lead to helping their care in other ways. So let's say you are a chiropractor who is really curious about the rehab. Maybe you want to add in a little bit more in regards to urinary incontinence or diastasis recti. Well, if you don't ask about constipation, constipation, like I mentioned, can really affect pelvic organ prolapse. Because if you have heaviness always there, or you're straining, that's not going to be good for pelvic organ prolapse, that extra pressure. The extra bloating is not going to be great for diastasis. The extra, the hardness of the stool and the extra straining is not going to be good for the hemorrhoid. So you asking all these extra questions will help just resolve a lot of their other postpartum issues. In my postpartum chiropractic course, it's about 20 hours long. One of the things I go through in the beginning is look at mom with her beautiful baby and look at that beautiful postpartum picture. Don't they look great? But then I list all of the symptoms that mom can be facing because there's so many. And my point is that we see this beautiful image of mom with her baby and it is beautiful, but there are so many things that we face postpartum that we as chiropractors with a simple slight suggestion, even if we don't have a ton of time, can fix something for them because we are the one who is listening to them. We are the one asking the right questions. We're the one asking more questions, right? So going back into that 3-step approach to becoming the postpartum expert, it is starting the conversation while they're pregnant, letting them know what you know, sprinkling in you want to see them postpartum, why you want to see them. The second part is really getting good at history and really getting good at the assessment. So I really like to teach people how to diagnose and assess diastasis recti because I think that it's done very poorly in a lot of settings. A lot of women have no idea they have it. And then a lot of other women come into me and they're freaked out about it. And I check them and I'm like, your core could use some work on getting stronger and working on some stability in your pelvis, but you don't have diastasis. And they've been freaked out and they weren't doing any movements that could have been helping them over the past year because they had diastasis. And so it really is overly diagnosed or improperly diagnosed. And you can get better at that. You can, in just a few moments, less than a minute, assess them better than probably they're being assessed in a lot of their other offices. And with that can allow you to give them some other suggestions with rehab, whether you have time to get on the floor and show them, or whether you have the ability to, excuse me, you have the ability to just send them videos of things you'd like them to progress through. So starting the conversation, getting better at history, more details, getting better at the assessment, knowing what you're doing when you're assessing breathing, when you're assessing engagement of the abs, when you're assessing diastasis, when you're assessing different tension in the pelvis, when you're assessing balance, getting better at that stuff, knowing exactly step by step what you're assessing for them. And then next is the treatment. What does our treatment look like? And the difference is going to be, are they a pain patient postpartum, or are they a patient postpartum who is wanting to get onto a maintenance plan with you? They're a postpartum patient who's wanting to get checked after birth. They might want to do rehab. They want to know, how to work on their posture because of nursing, all that type of stuff. So pain versus no pain, the plans are different. I will encourage you to think about what is realistic for a new mom. Is it realistic? And is it within what you would recommend in general? Would you recommend a postpartum patient to be at home resting and healing her body, or going out for appointments? Do you think which one is more important? And I don't know the answer to that completely because it depends on what's going on with that patient. But for many of my patients, I want them resting for the first 2 weeks. Now, if they broke their tailbone in birth, come in. If they have breastfeeding issues, come in. If they have something like that, yes, I want them to come in. If they have severe sacrum pain, yes, come in postpartum as soon as you can, as soon as you want to, so we can start navigating that pain, because that's going to really impact your postpartum. But if they're not having pain, they're uncomfortable. I mean, we have different birth aches, but if they're not in pain, can they rest at home and come in at 2 weeks? What are the plans looking like for them? Are we expecting them to come in 2 to 3 times a week for postpartum care, and then we're getting mad that they didn't come in for that plan? We're calling them non-compliant because they didn't come in 2 to 3 times a week postpartum? Or could we be setting more realistic plans for mothers? Because what can happen is if we expect too much, we make somebody feel bad for not coming in, or what can happen is they just don't come in at all. And another thing too is that if we don't provide the care that they really are needing in that time, they're going to go to somebody else who's providing that care. What I mean by that is if they're having breastfeeding issues, that trumps all their other stuff with diastasis and pelvic floor and their sacrum discomforts, because they're really wanting to get breastfeeding conquered and make that work for supply. They don't want pain, all the things. Then they need to be solving what's going on with breastfeeding. They're not going to be focused on their diastasis, not going to be focused on their sacrum pain, their posture. They want to solve the breastfeeding pain. And we can help them with that with different things. We can, help them with, with their own system, regulating their nervous system. We can help their baby. So we need to get their baby in. So we need to give them realistic treatment plans based off of that stuff. So if it's a baby that has tongue tie issues or is having a hard time latching or is colicky or torticollis, I might see them more. But if their baby isn't having all those issues, then I might see the baby less. I'm not going to have the same treatment plan for every single patient. And I really hope that other chiropractors are on the same page with that. So recommending a realistic treatment plan for mothers of newborns. So again, if the mom is having pain, come in. Day 3, day 4, whatever it is. And then I see her once or twice a week if she has a lot of pain. I'm going to give the example of tailbone pain. If she is not having pain, I have her rest for 2 weeks. And when she comes in, it's going to depend on what we're working on. But most of those moms, I'll see them once a week or every other week. And usually it's every other week to give them time to do the mobility for their mid-back, the strength for their mid-back, to give them the exercises for their diastasis, to give them exercises for their pelvic pain. Again, if they're in pain, acute, I see them more. But if not, I space out their appointments. Why? Because they have a new baby and it's hard to get out of the house with a new baby. And we want them resting. So I want them to get care. I do. But I want to be realistic with that expectation. So pain, we talk about increased frequency. If they don't have pain and they're coming in to manage their body after birth, just get a reset, if you will, and maybe they want to start on rehab, it's not as essential that they start right away. And I can start giving them the rehab during pregnancy of what they could start doing in that first week or two before they come see me, which is great because what that does is they see, oh, Dr. Nichelle has given me these 3 exercises to work on. It's usually breath work, some activation stuff. She gave me these things. She knows what she's doing for that next step. So I want to go in at 2 weeks for my next step because I'm ready for it, because I was given the first stuff to do. Now I want the second set of things to do. So just keep in mind how it can be hard to come in multiple times a week with a new baby. Once a week, appropriate. I think twice a week, unless they're in acute pain, is going to be really hard for moms. And then it makes it hard for them to want to come in because then they feel bad, if it makes sense. So they're like, I'm not following the treatment plan. I hear chiropractors online saying these patients are non-compliant. And then I hear how often they want to see them. And then it makes me worry that they're losing those patients that could be really awesome patients if they just spread out those sessions for that new family. And also consider like somebody like me, postpartum with my 4th kid. I'm like, how am I supposed to get in multiple times a week with my other children as well? Am I supposed to bring in all my kids? I'm like, postpartum myself and like managing all the bags and everything. Like it's a lot. So looking at what that looks like. And if you can be an in-home provider, that's really awesome too. So with treatment, you can incorporate rehab exercises into the appointment. So if you know what you're doing, and I outline that in my postpartum course, and I'm going to give an offer here at the end. But if you know what you're doing with rehab, like these are things I give women in week 1 through 2, 2 through 4, 6 and beyond for running. These are the things I give. Then it's simple. When someone's in your office, you say, how is this going? They're like, oh, it's easy. You watch them do it for 5 seconds, 10 seconds. And you're like, okay, cool. Keep doing that. But now I want you to add in that rotational component to it as you're engaging that pelvic floor and then lower abdominal wall. So you're going to breathe in, breathe out, and then you can do a quick demo. That could all take 1 minute or less. If you don't have the time for that, we'll talk about what that can look like, because there's a lot of other ways to do that. So there is the long appointment time, 15, 20 minutes, that you might demo it, watch them, maybe adjust their form, and then you'll send them the exercises. And then there's the shorter appointments that a lot of my colleagues have, which are maybe 2 to 5 minutes. And you can say, hey, have you been able to do those exercises? And they say, yeah, they're easy. And of course, I'd love you to be able to look at them, but there's time constraints, right? So you can say, hey, I'm going to send you a PDF that tells you the exercises that you can do in a progressive order. They're outlined by the weeks. So weeks 0 to 2, 2 to 4, but know that if movements are too hard for you, stay back at those easier ones and progress as they get easier for you. And we want to make sure you're not having symptoms. So you can have PDFs you send them. You can have video links that you send them. You can have a rehab portal. So we use Physiotech. It just changed to Wibby. And we send that to them. So we send them all their exercises, and then we can send them a PDF as well. So there's a lot of ways you can do this. If you go to YouTube and you type in Gaia Health, I have a ton of my rehab exercises on there. So if you don't want to reinvent the wheel, or if you just don't have time for it right now, but you want to start immediately being like, hey, I want to give them this exercise, glute bridges with band, single leg arc to work on balance. I have them there for you, and I'm explaining it out why they're doing it and everything. And I still have so many more to add. So that would be a channel definitely to check out that you can send links to. I know a lot of my colleagues that I went to school with will send the links of my videos to their patients, the prenatal videos I have, the pediatric ones, and those postpartum ones. So keep in mind that if you have shorter appointment times, there's so many other ways around this. You can still be giving really good care to your patients. Knowing what to treat is also really important. So postpartum sacrum. So the big thing that I want everybody to check at their initial postpartum appointment with their patients is that sacrum. Again, look up what a rhombus umbilicalis looks like, which is that sacrum coming back when a baby is going through the pelvis. And it is exceptional to see, but that is exactly why I want you to check that sacrum. And is that sacrum just back, or is it back and rotated? And a lot of times you'll see it back and rotated based off of how that baby twisted out through mom. So if you know the process of birth, it's pretty phenomenal about how they rotate through the canal, but that can impact how that sacrum is shifted as well. Of course, positioning of mom can impact that too. So postpartum sacrum, man, the adjustment postpartum on that sacrum that's a solid one. You're like, it sounds so different than other adjustments. Another area to really know what to treat and be like aware of is T12, because you look at nursing and you think, okay, it's just here. So you think about this area, but it's a lot down here because of that rounding. So knowing those things, those little things. So like, of course, the neck, of course, the upper T's, yes, all that stuff. But if you know how to tell your patients, posterior sacrum right here, this is why. T12, I call that nursing posture, the nursing pivot point. They're like, oh, she knows what she's doing postpartum. They feel a lot more confident with you. You also feel confident, right? So knowing what to treat. Let's say somebody has tailbone pain after birth. They may not know if it's broken or if it was a sprain. There's still some things that you can do for them regardless if it's broken or a sprain, because tailbone, you can still adjust the sacrum. And there's a lot of ways to adjust it, right? We don't have to just do side posture. We can do a drop. We can do activator. There's so many ways that we can work on that, but you really can't even do a side posture if you're high up on that sacrum. But you want to be talking to them about relaxing their pelvic floor, relaxing their groins, relaxing their lower, their glutes, rolling them out, working on breath, and then talking to them about how to sit. So there's so many things that if you know what to treat, like this can happen for women, then you can just dive right on in and patients know you know what you're doing. The other thing with treatment is assigning the appropriate home care and lifestyle recommendations. So I'm going to talk more about that at the end here, because there's so much in my postpartum course that dives into all of the home exercises, demos, what they look like. But there's so many things with lifestyle recommendation about how to sleep, positioning, things like that we can be giving our patients. We also need to know when to refer to other health professionals. So building those connections, knowing what is in the hands of lactation, what is in the hands of pelvic floor PT, because I work alongside and refer. My number one referrals are lactation consultants and pelvic floor PTs, because pelvic floor PTs I refer out to a lot of the times, but I still have patients coming to me for the adjustment and then updating their rehab care because they like my approach better than a lot of the pelvic floor PTs. And also because they're coming in for an appointment. And if they have the ability to get a lot of the same care with me, great. I don't do internal pelvic floor work. So I send out all the time for them to tell me what their prolapse looks like, what level it is. I want to know if there's tension in the pelvic floor, if it's tight. So I send out a lot for that, and I co-manage with pelvic floor PTs, and we kind of go back and forth with exercises, and we email each other about that too. And they don't feel like toes are stepped on at all because they know I'm referring to them. Something that I also want to be aware for people with treatment is knowing that like we really shouldn't have the treatment protocol, because that is more like I do this and then this and then this and then this. And we really should understand the principles of what's going on, because then that allows us on this big scale continuum. I'm going to talk about postpartum because that's what this is about. this postpartum continuum of where they could be with their rehab care, whether it's mobility or exercises, if we know to plant them here, then we know the progress of where to go. But if we don't even know how to assess to say that this is where they're at, like this is where they're at in the scale and this is where we go. So diastasis, they have 3-finger gap and full tension. Where do you put them on the scale? Versus if they have a 2-finger gap and they have, like, you can push your fingers all the way into their diastasis and it goes down to your like third knuckle, where do you put them on the scale? Because they're going to be a lot more at the beginning with less tension than the one with the wider gap. And so you knowing that, knowing the scale and knowing where to put them really helps you with the continuum of where to go. And that makes the progression or the regression on things so much easier. So it's knowing principles and knowing like where somebody's at in the scale, than necessarily I do this and then this and then this and then that, because not every person is going to follow the exact same patterns. And I find that with a lot of the techniques that are taught in pregnancy is that patients just don't follow the same pattern. There's not always a rotated pelvis. Things are different for every single person. So protocols make that hard. We want to focus on the principles. So I want to tell you guys a little bit about my postpartum course if you haven't already taken it, because I know there's a couple of you on here who have. It is a course that takes a deep dive into literally all things postpartum. It includes a ton of research. So there is a lot of citations in here, as evidence-based as chiropractic can be, because there's a lot of lack of research, right, in our field, and it's getting better with people like Heidi Havoc and things like that. So it takes a deep dive into all things postpartum, from common conditions that women will face to nutritional considerations to, I love this part, the 12 considerations for postpartum rehab. So things to check off to make sure they have mid-back mobility and to check out the tension in their abs and things like that, along with giving the exercises with it. And then we teach you really, at the end of the day, how to become a holistic chiropractor and become that postpartum expert in your community, improve your treatment outcomes because you know what to assess, you know what to ask, and then it really to help you with that continuity of care. Because if you learn what I have to teach in the 20 hours of my postpartum course, then you are going to be in a lot better shape than you were before with continuing that care. What I mean is you learn it. Now, when your patients are pregnant, you feel really confident with getting them in the door for postpartum. So I really encourage you to look into what my course is about, because it can really change that for you in terms of what your style looks like in your practice and how you're able to keep a patient. Because what I found is prenatal patient comes in, I lock them in postpartum. They often get their babies in almost always, but not always. And then now their husband comes in and now they're a patient for life. But if I have them during pregnancy and I lock them in for postpartum, that's such a big transition in life between pregnancy and postpartum, between being pregnant and then having another child, having your first child or another child, that we can lose them in that limbo. Let's not lose them, because this is something that we can really have such good care for these patients, give them such care that they need by just us knowing more. So for a limited time, if you purchase the postpartum course of mine, you will get as a gift the Gaia Health Movement and Mobility Guide. So that's going to break down signs of intolerance, the cues that you can give patients, along with what to do in weeks 0 to 2, what to do in weeks 2 through 4, what to do in weeks 6 weeks and beyond, what to do if somebody's a runner. So break down all of those rehab exercises, what mobility things that you can be prescribing to them. So this is a $150 value that if you buy the postpartum course in the next week, that you will just get as a gift, and we'll send that to you right away once you sign up. Now, what are some objections, some limitations to the course? Well, cost, right? That's with anything that we take, there can be a cost issue. But I encourage you to consider, what's the cost of not expanding your knowledge, becoming confident in it, improving your treatment outcomes, really being that expert in your community. And there's a big cost. There's a cost to the patients, to be honest, because they could have this chiropractor who knows so much more of how to serve them than their midwives and their OBs and their doula and everybody else knows. And it also could miss you out on appointments. So if you have somebody in your office for, let's just say, 6 to 10 prenatal sessions and they drop off because you're not confident in postpartum care, you're missing out on thousands of dollars that they could be coming in for postpartum care and for newborn care. Just one person. Now, the other limitation that people have is they're like, you seem like you add a lot of rehab and exercises. I don't know that information, and I don't care to know it because I don't have the space for it or the time for it. So let's dive into that. If you don't have a dedicated rehab space, really all you need is the little tiny area that your body could lay on next to the table, or the table itself. You don't need a big rehab space. We designed our office for that, but you really truly don't. I've been in smaller offices in the past and it was not a problem at all because I really just need a tiny little area to work. I sometimes use the table as if it's a bench, a chair next to me as if it's a chair that I'd be using for their rehab. I can use bands off of the table if I want to demonstrate something there. I can demonstrate something on all fours on the table or right next to it. So space really shouldn't be that big of an issue because also if you're not going to demonstrate, you can say, hey, I know we talked about some things you can do for pelvic stability. I'm going to send those over to you. So you don't even have to demo them. You can just send the videos over for them with very clear instructions of what to do. Now, the other limitation is that a lot of people are like, well, I don't have the appointment times that you have, so I don't really know if learning this extra information would really be worth it. And let me tell you, it is. This extra information really is worth it because you don't have to have all the time in the world. If you have 2 minutes with a patient, you just have to have all the information in the world. You can then send out that email campaign drip. You can send out PDFs. You can get video links. You can get them on a physiotech, some rehab portal, whatever one exists out there that you might already be using, or that we're using one that the physiotech turned to Wibby at this point. So I want to empower you here that you do not have to have increased appointment time. You can absolutely improve your patient care if you are the chiropractor who has 2 minutes with your patient, whether begrudgingly or by choice. You can absolutely give more. And if you have staff, this is the easy thing to tell them to do. Hey, postpartum patient came in, send them this PDF and that campaign drip. Boom, you don't have to worry about it. And just having those plans of what it looks like when this person comes in the door. So if you have resources and you have that flow, time doesn't matter and space in your rehab space doesn't matter, right? So those are some common objections, some frequently asked questions. I'm going to get them out of the way here. Is with my postpartum course is you have lifetime access. It's self-paced. It has 10 PDF downloads for you to help guide you or your patient. So it might be something for you with intake, or it might be something for you to actually hand out to your patient, like the rehab exercises. You can begin using the material that you learn immediately. That's how, whenever I lecture, any course that I teach, that is my common objective, because I don't have that much time in my life to hear people do these long intros. I want to know, what can I do biggest bang for my buck right now? And so I want to leave you with a couple things tonight as a challenge. But other frequently asked questions are, yes, you can begin the material immediately as soon as you sign up. You have access to it and you can implement it immediately as well. You can receive 19 CEs for my postpartum course, 10 for my prenatal course, and then 4 for my tethered oral tissue course as well. So those are all approved for PACE. That means that there are 33 regions that are approved and get automatic CEs. You have to let us know if you want to get CEs as well, so we can apply for those for you. And then if you are not pre-approved, or if you're not pre-approved, if you are not in one of those regions, we are pre-approved for you. So a lot of times you can just submit to your state our course and they will accept it depending on which state you're in. So I want to thank you guys for being here tonight. I encourage you in this week in practice. My challenge to you is to start the sprinkle. What can you do tomorrow in practice, or Thursday, or whenever you go in? What can you do in practice that is with your prenatal patients that starts the conversation for getting them in prenatal or postpartum? Sorry. What can you say to them? Do you want to talk about the rhombus semicalis in their posterior sacrum? Do you want to talk about postpartum rehab? Do you want to talk about infant care? Talk about something with them starting tomorrow so that they know it's something you also do. And a perfect example of this is sometimes I don't make it very aware to people that I adjust hands and feet. And I'll say something like, oh, or jaw. I'm like, oh yeah, do you want anything else? Like jaw, blah, blah. I'm like, you do jaw? Yeah, I want my jaw worked on. And you're like, oh, it's crazy. I need to let more people know that I work on the jaw. So my point of this is make sure they know that even though you're a prenatal doctor, you also are a postpartum doctor. And if you don't feel confident with that yet, my advanced postpartum care, the chiropractic clinical guide, is absolutely a place for that. So just a reminder that if you haven't started my course already, that if you sign up for it, the 20-hour postpartum course, you are given a gift of my $150 value Gaia Health Mobility and Movement Guide that'll be sent to you when you sign up. I'm going to go off into the chat here real quick and see if there's anything else I should address. I do want to leave with I think it's Jarena. I don't know if that's how you pronounce it, but you wanted to know the top 2 recommendations to patients to come in postpartum. I know that sounds silly, but to come in postpartum because of that posterior sacrum. That is a huge one. And the other huge one is to make sure that they know what we do for infants, what we do for kids, because that one's huge and they are not aware of that. So I know it's like your top 2 recommendations. Well, not necessarily a mobility thing. My recommendation is to, when they're pregnant, make sure they come in for those 2 cases, postpartum and pediatrics, and let them know why. All right, you guys, you have a great night. Reminder that we'll send you some emails out about this, but for limited time, there's 1 week for you to sign up for that postpartum course. I appreciate you being here tonight, and I'll talk to you soon. Bye, you guys.